Hey there, welcome back to the channel. Today we're going to talk about medical, specifically medical services in remote countries such as Ecuador and countries around the world, and what you need to do to prepare yourself to receive these. And recently I had to have surgery, my first surgery. It went very, very well. I was very pleased with it. I did it down here in Ecuador. I'm going to tell you some of the issues I wish I would have known before I had surgery, so I could have prepared a little bit better for it. Okay, first topic, and there's no way around this whatsoever, but if you're going to talk medical, you have to talk insurance. Okay, the first question is, do you need it? I mean, sometimes medical care is so cheap in these countries, you can just pay out of pocket. Well, the answer is yes, but the reason may surprise you. Okay, insurance. So many expats think you need insurance for routine medical costs. And the reality is you can usually pay those out of pocket. What you need the insurance for is the crazy expensive ones, the cancer care, the surgeries, the ICU stays, things like that. But most importantly, one of the primary reasons you need insurance is because you're actually required to for your visa. Now this depends on country, of course. For example, here in Ecuador, it states it very clearly on the visa itself, the permanent residency visa, I should say, actually it's a residency permit, the permanent residency permit that says we must maintain health insurance. Whether that's through the public system here or through a private plan or a global health plan, it doesn't matter as long as it covers you in Ecuador. I think Colombia is the same way. Panama, on the other hand, I don't think requires anything. So that is very country specific. Know the country you're in before you find out that you need it, you don't have it, or it causes problems with your visa. Types of insurance. You can get local insurance for where you are. That's really easy, usually quite cheap actually in the countries. There's also global insurance coverage, usually a little bit more. If you wish to add the US to that, if you're a US citizen and you want to have coverage while you're in the US, that's a lot more. And of course there's travel insurance, and we'll talk about that in a minute. The choice between local or global pretty much depends on your lifestyle. I love Ecuador, I spend a lot of time here, but that's not the only place I'm at, and we like to go back to the US. My wife actually spends more time there than I do. So we have global insurance that covers us whatever country we're in. I think it doesn't cover like North Korea and Iran. Who cares, we're not gonna go there. Where we wanna go, it covers. It certainly covers here in Ecuador. And it covers in the US because we pay a lot extra for it to cover us when we're in the US. Local policies, dirt cheap, covers you in the country you're in. Like for Ecuador, I think we actually have one that I probably don't need it, but I think it's like 120 bucks a month here in Ecuador for insurance for both of us, and the global policy is in the hundreds of dollars leaning towards 1,000. So it's quite expensive. There's also a beast called travel insurance out there, which for the most part, travel insurance has nothing whatsoever to do with medical insurance. It's just insuring your trip so you can get reimbursed if something goes wrong with the trip. However, there are policies associated with travel insurance that can also cover medical expenses. These are usually emergency medical expenses and evacuations back to your home country. So these have their place, but it's a general rule for a digital nomad. No, you're popping around. You don't necessarily want to go back to whatever you consider your home country to get medical care. You probably want to get medical care where you are because that's where you are right now. That's where you're living for the next several months. I certainly don't want to be evacuated back to the United States for health care. Oh God, no. So those policies usually are worthwhile. Plus, there's usually limiting factors about whether or not you have residency in the country you're visiting, and there's usually a length limit on how long it applies for your travel. So the travel insurance, travel health insurance is probably not what you want, but certainly global or local insurance, depending on your travel patterns, makes sense. At some point when you're living in a country, you're probably going to have to decide whether or not you want to use their public system or their private system. That obviously depends a lot on the country you're at, the cost and availability of private insurances. Certainly South America, so far, the countries that we've been to and that we hung out in for a while, Peru, Ecuador, Colombia, we want to go with the private systems there. The public system's just quite not up to speed for our tastes. But that depends on country and of course your tastes. Now once you have insurance all lined up, you've got to pick a place to have your health care taken care of. Now, if you're just doing regular health care, you probably want a doctor that speaks your native language, and certainly you can find those. Personally, here in Ecuador, because healthcare is rather cheap, I pick a doctor who not only speaks English, but comes to my apartment for me to do my regular physicals. I just pay him out of pocket. I don't even bother with insurance. When I needed to have surgery, that was a different matter. As I pointed out on this channel, and you've obviously seen videos of me, I'm not dainty. The average Ecuadorian is like 155 pounds. I'm 300 pounds and 6'3", a little bit more than 300. So I don't fit on an Ecuadorian bed normally. The Ecuadorian instruments for laparoscopic surgery, which is what I had, aren't long enough to get to my organs. You need extra long equipment. So we researched for facilities in Ecuador that have those capabilities, that are used to dealing with not only large people, but also the specific term is bariatric patients, for people who are more fluffy like me. And we researched that and found a facility in Quito through looking at reviews, Google reviews, and looking at the profile of the hospitals. Another place we look for is on our insurance website. What hospitals does the insurance direct pay, and what do they recommend? Those are two separate items. There's what they recommend that may or may not be direct pay, and then there's the ones that they have direct pay associated with. Direct pay is nice if you don't want to pay it all out of your pocket up front and go back to your insurance. Obviously not necessary, but it is nice. And so we chose a hospital recommended by the insurance company that had great Google reviews and had direct pay. But there's one other little piece that we use to choose a hospital. This is sort of a big one. In the United States, there is an entity called the Joint Commission, which accreditates hospitals. In the US, you pretty much need the Joint Commission accreditation to be a serious hospital. There is an international version of that from the same group that goes out and does accreditation for international hospitals. There's one in Ecuador, it's in Quito, and that is the one we used. And we had a very proper, established hospital. Now, does accreditation mean that it's great, perfect, and all the surgeons are great? No. What it does mean is they have standardized procedures, they're vetted, and you have a higher likelihood of having a good outcome there. And so that's what we went with. And of course, we picked our surgeon the same way. We researched him both here in Ecuador, and we researched his credentials in the US because he was also licensed in the US. And being a US person, I liked the fact that he was licensed in the US. I liked the fact that he did his fellowship in the US. And this is all available online. So he's accredited in the US, did a fellowship in the US, speaks perfect English, and you can find people like this around the world. You just have to do a little research. We frankly just used Google. And then, narrowing down after Google, we validated the Google results through the AMA, the websites in the US, and of course, for the accreditation for the hospital, going to the accreditation site and validating that it does have a current accreditation. And I'll leave the links for the accreditation site and for the site we looked up for validating the physician in the US in the comments. So after we had picked the physician, and this is a wonderful thing about South America, we actually interviewed the surgeon. Emailed him, he texted back, we got on WhatsApp, and I talked to him. And what I want to know is, first of all, are we going to jive? Can he answer questions? Does he understand, what I'm looking for in a surgeon? Does he meet those qualifications? And I want somebody who's good at communication and somebody who has done a few of these. So I quizzed him, how many surgeries has he done? For example, we are looking for a hospital here in the beach town we live in, and they have some nice looking hospitals, but they just don't have any patient volume coming into these private hospitals. There's several of them, and there's not enough to share patient volume across them. Whereas the hospital in Quito, the surgeon, he has literally done thousands of the type of surgery I need on larger people like me. And so I want somebody with that level of experience. And that pays off if there's any complications. They are better at handling it if they've done it a lot of times. So that's a big thing I wanted to check. The other thing is that second opinions are cheap outside the US. So if you're not comfortable with your surgeon, or you don't think you're getting an answer from your physician that you want, go to another one. There's plenty of them around. Go get a second opinion. It's cheap. And I did. And I went with the first guy that we talked to because everybody agreed I needed the surgery and he was the best one to do the surgery. But since second opinions are cheap, why not get one? The other thing about being outside the US with picking a facility and a provider is it's kind of fun because there's actually something called price transparency. You can go to the hospital and say, how much will this procedure cost? Now, you're not going to get an exact answer. You're going to get a range, and that range may be somewhat off if your surgery gets complicated. Mine was certainly, ended up being a little bit more complicated, running the price up, but it was still a reasonable price. I mean, we're talking costs that are, even with the extra cost added on because of some complications that the surgeon ran into for me, it was still only 14% of a comparable surgery in the United States. That's just mind-boggling. You know, there's a difference between, oh yeah, I can pay this out of pocket and hope the insurance reimburses, versus I would go bankrupt trying to pay it. Totally different mindset. And lastly, for choosing facilities and personnel to do the work, use AI. Now, I'm not saying use AI to diagnose yourself. What you're using AI for is to get lists of questions to ask the surgeon or the medical professional you're working with, list of questions to look and ask at the provider, at the facilities, and then also ways to validate the responses from them to see if they seem valid. You can also use it for research because most AI systems have direct web access now, can also do research. You can punch in to the AI the responses you got and see if that makes sense to the AI given the website that it's looking at. So it's a really handy tool. Again, not for diagnosing, but to learning the questions to ask and to validating the responses that you get. Now here's a big thing that I did not do and I wish I would have. If you're in the United States and having worked on in a hospital, the rules in the United States require that you have a certified medical translator if you don't speak the native tongue of wherever you are, which is almost assuredly English. So if you're not a strong English speaker in the US, the hospital is required to provide a medical certified translator. Now this is a medical translator, not somebody who speaks both languages. These are people that are certified to speak and translate medical terms for you. This is a big deal. This is not a requirement in Ecuador. So when I did the procedure, the surgeon spoke flawless English. We had no trouble communicating whatsoever. The secondary providers, the residents, and the nurses, not so much. The residents sort of spoke English, but not very good. Not terrible, better than my Spanish, but they weren't native English speakers and they couldn't get the information out as well as you would get with a translator. The nurses didn't speak any English whatsoever. So that communication was minorly challenging. There's Google Translate. I speak Spanish to some degree, so it wasn't terrible. But if you're not feeling well, you're sick, it's nice to have a translator that can help you be more precise with that translation. And the services that they use in the US are commercially available around the world. You can get an app on your phone to do this, either video or straight audio, with a translator who speaks both languages well and also medically both languages. And it's a pay service as you use it. We didn't do this. In retrospect, I wish I would have done this. I will leave links to 3 that I found. I haven't used them, but 3 that I found that also my wife was familiar with one of them because it's the same one that they used in the hospital she worked in the US. But having a medical translation service to help you with the non-English speaking or the partial English speaking staff, assuming you speak English, would be a big thing, and it's one thing I really wish I would have done and I did not do. Another advantage to the translator is being able to understand follow-up instructions. I'll give you an example. I got 2 sets of follow-up instructions in the best English from the residents who spoke reasonable English but not great English. And through the translation, they gave me a particularly dangerous set of follow-up and discharge instructions. Now, I already knew what I was supposed to be doing. I didn't need the resident, the primary attending physician. I had already talked about it with his flawless English, and it was no problem. But if I would have followed their instructions as they said it, it would have caused me problems, potentially lethal problems. When I spoke back to them and corrected them with the plan that I knew, they agreed that's what I was supposed to do. So it wasn't a medical problem, it was simply a translation problem because I wasn't using a good translation service. The other issue was just people not reading notes, and we won't go on there because that's everywhere in the world. Resident physicians not having time to read the notes and give you the right instructions. That's another problem, but that's not a problem for this video. We will follow up on those sort of problems with the final point of bring an advocate with you. When you're going through surgery or you're sick in the hospital, the last thing you need to be doing is arguing with the staff. Bring somebody to argue for you. Be an advocate. This transcends countries. If you're in the US, going to a US hospital and you speak flawless English, you probably want an advocate with you. And you certainly want an advocate with you, preferably one that's pretty bilingual, but somebody who can speak the language to the facility to get what you need from them. And so they can make your point for you. And also ones that understand medical is nice. I have a built-in one. My wife's a nurse. She's always my medical advocate, and she's really good at it. So I don't have to worry about it too much. But somebody who knows medical, who can also talk preferably a little bit more native to the folks at the facility, make really great advocates. So that's pretty much all I have to talk about on that. Insurance, bring an advocate, pick your provider carefully, use reviews, you can get price estimates, and get a translation service. I'm going to leave you links for the translation services, the websites that I looked for accreditation for the physician in the US. He has Ecuador credentials as well, obviously, but I was more interested in his US credentials, so I'll leave those websites. And like I said, the translation websites. And the accreditation website for the facility, I'll leave that link as well. I hope you never need this advice, that you go through life without having to have surgery. But if you do have to have surgery, I hope you find a facility as professional and good as I did, with a surgeon as skilled that I found. And I just had really good luck there. And I want to do a shout out to Javier, my surgeon. Thank you so much. I will leave his contact information also in the video if you happen to be living in Quito or the Ecuador area and you need a surgeon, because he did a damn fine job. So, till next time, hope to see you out on the road. Take care. Ciao.